Well, good morning, everyone, and welcome to our webinar this morning. Today we are talking about OSHA's new emergency temporary standard for healthcare workers. I'm Sarah Willey, and I'm joined here with my fabulous colleague in Wing Woman, Sandy Andre, and we're going to be walking through the requirements of that of OSHA's new ETS. So thanks for joining us. We're going to start with a short overview today, starting with why OSHA implemented the ETS. And then we're going to walk through which organizations and which parts of the organizations the ETS applies to. And after that, we're going to really dig into the details of the specific requirements of the ETS. Based on questions and phone calls that we have been getting, that the questions about does it apply to my organization and which parts of my organization does it apply to, I know probably many of you have questions on that too. So we will be no fears. We are going to be covering that this morning. Okay, Sandy, why don't we start with why there is an ETS? Thanks so much. Okay, so let's start with the why. And normally we don't really talk a whole lot about the why when we are covering these legal updates. But for the purpose of this OSHA ETS, I do think it's important to give an overview of that why. And that is because the detailed requirements of this ETS and the way that it's written leave quite a bit of uncertainty as to exactly what is required and what is not required. Okay, so as we work through that, and as your organization is making decisions about the best path to compliance here, it is helpful to have the context of why OSHA implemented this in the first place, okay, because that plays into potential risk. So what OSHA has said in its detailed comments regarding the ETS is that they believe that employee exposure to COVID prevents what they are calling a grave danger, okay, and that's the standard they need to be able to enforce this thing, to workers in healthcare settings where people with COVID-19 are reasonably expected to be present, okay? And again, that is going to play into our discussion about which healthcare organizations are subject to this ETS and what parts of those are, okay? And how your organization can best position itself to be in compliance with the ETS and avoid any significant penalties, okay? And to that end, right, let's talk for just a second about compliance. I've also gotten a lot of questions on this. Compliance in the sense of, okay, if we don't, if we make decisions and are not 100%, it turns out that we're doing our best to understand what this ETS requires, but what if we're wrong? What's the potential penalties, okay? And so this chart on this slide lists the types of violations and the maximum penalties for each, okay? So there's serious, there's other than serious, there's a failure to abate, and then there's a willful and repeated violation. As you can see, there's a significant difference between the first three and the second two, okay? So when we're talking about very technical requirements of this ETS, for example, we've gotten questions about, we understand that we need to pay employees when they have to be off for COVID-related reasons. Can we require them to use their available PTO, okay? And so we've given advice on that. The answer is not clear in the ETS, to be honest. So we're reading it and doing our best to provide the best advice we can. However, if that turns out to be wrong, that's not going to be a willful, or it's probably is not going to be a willful or repeated violation. That would be some other smaller $7,000 so violation, etc. Okay, just to give you an idea. Okay, so that's the why. So as we're talking about this, remember OSHA's intent here is to enforce this thing so that they can protect those healthcare workers from a grave danger, because they have to be in contact with people who are reasonably expected to have COVID-19. Okay, Sandy, next slide, please. Okay, just quickly, when does it apply? So this was announced on June 10th. It is effective, meaning you have to comply with it. Oh, I'm sorry, it wasn't effective until June 21st. That's the date it actually got published in the Federal Register. Okay, so it's effective, but the compliance dates begin July 6th. Okay, and that's for most of the provisions in the ETS. There are just a couple of provisions for which compliance is not required until July 21st. And as we go through the requirements in the ETS, we are going to be pointing out to you which provisions those are. I'm getting this question a lot. When does this thing expire? Okay, so OSHA can promulgate this thing for a total of 6 months. At that point, they have to decide whether they are going to promulgate a permanent standard, okay? And my OSHA, right? So my OSHA has also passed an emergency rules that mirror this ETS, okay? Those are valid until December 22nd, 2021. Okay, so we are looking for both OSHA and my OSHA. We are looking at December 21st, December 22nd, 2021, about 6 months from now. Okay, so let's dive into to whom and where does the ETS apply. We're going to go through fairly quickly what the ETS says, but I'm going to also tell you all that at the end of that, Sandy and I have gathered a list of examples of different healthcare settings, and we're going to go through those and talk about whether or not the ETS applies to each of those. Okay, so some examples include ambulatory care settings like a dentist's office, maybe a mental health facility. We're going to talk about whether they apply to different departments within a hospital setting, et cetera. Okay, but let's start with the broad overview here. The ETS says that it applies to all settings where any employee provides either healthcare services or healthcare support services, okay? And then healthcare services are defined basically as services that are provided by individuals who are professional healthcare practitioners. The OSHA's comments to that also make clear that they mean a practitioner who is licensed or registered, right? So somebody who's doing something that requires licensure or registration with the respective state, okay? And then healthcare support services is a very broad term, of course, and that is defined to include those other things, right? Not direct patient care, but those other employees who are supporting those healthcare services in different ways. And the examples they give include patient intake, admission, food service, housekeeping, laundry, etc. we are reading that definition to understand that OSHA is talking about your employees, your healthcare employees, who may not be the direct patient care individual, meaning not a doctor, a nurse, a PA, a CRNA, etc., but are otherwise having direct contact with patients or are engaged in some sort of direct contact with handling waste, reprocessing, laundry, housekeeping, etc. Okay. So that definition is very broad. Okay, so when we think about this, ETS applies to all healthcare settings where any employee performs those things. Out of the box, that appears to be incredibly broad, right? Luckily, right, and helpfully in some ways, OSHA then wrote this thing to start broad, but then list several exceptions to it, okay? Quite frankly, it would have been much more helpful if OSHA instead had just told us more specifically who they meant to apply it to. Unfortunately, they didn't write the ETS in that way. Instead, they wrote it to be very, very, very broad and then carved out a lot of things from that. Okay, so that requires more analysis on our part. Okay, but let's go through the exceptions. First, it doesn't apply to first aid by an employee who's not a licensed healthcare provider. Okay, well, that's fantastic, right? So if you have a workplace in which employees are trained to provide first aid as needed, but they're not licensed healthcare providers, you don't need to worry about this. Okay, the thing that maybe comes to mind for me about that is a local pool, right? You have lifeguards who are trained to do CPR and other things, and they might have to do that in the event of an emergency, but that doesn't mean they're providing healthcare services under this ETS. Okay, so if any of you are listening and that's not, and that is you, good news for you. You can choose whether to stay on or not. Second, the dispensing of prescriptions by a pharmacist in retail settings. Okay, so here we're talking about a pharmacy in a grocery store, okay, and a pharmacist is only dispensing prescriptions, okay? If that's you, then this ETS does not apply to your retail setting either. I will note that pharmacists and others who work in pharmacies in a retail setting, however, quite often do things in addition to the dispensing of prescriptions. So hang on, there may be some parts of your pharmacy that this does apply to. Okay, this third exception here is a really important one. And that is the ETS doesn't apply to non-hospital ambulatory care settings. So by that, they mean not inpatient care. Okay, so it's not a hospital and we're not providing inpatient care. You don't have to comply with this so long as you can screen all non-employees prior to entry for COVID-19, and you can then deny access to anyone with suspected or confirmed COVID-19. Okay, now that second part is a challenge for many non-hospital ambulatory care settings because they don't necessarily have the ability to exclude people who have suspected or confirmed COVID-19, or it would be entirely contrary to their mission to do that. So there is a difference here between maybe a dentist's office or a PT practice, right? Who can screen individuals, and if they have suspected or confirmed COVID, they can reschedule them and have them come back another time. And it's not an emergent healthcare situation if they are not allowed to enter on that day. On the other hand, we have different settings, maybe a clinic that provides emergency mental health care, maybe a different type of urgent care clinic, right? They are going to, it's less likely that they are going to be able to take advantage of this exception because they're not going to be in a position necessarily to exclude individuals who have suspected or confirmed COVID-19. Okay, so we understand that balance and that push and pull when we're talking about those. Next exception it applies to the hospital ambulatory care settings. So this would apply to the non-inpatient parts of a hospital, okay, within a hospital. For those settings, the ETS does not apply only if all employees of that setting are fully vaccinated. And then in addition, you've got to do the screening and exclude anybody with suspected or confirmed COVID-19. So if you're an ambulatory care setting and you're in a hospital, you also have to have all of your employees fully vaccinated in order to take advantage of that exception. Okay. The next exception involves home healthcare settings. Okay. There is an exception for them, but it's just like the exception for the hospital ambulatory care settings. And so the exception would only apply if all of your home healthcare employees are fully vaccinated. So your employees who are going into homes to provide those healthcare services, and the screening is performed, and you don't perform basically the home health services on that day if there is somebody with suspected or confirmed COVID-19, okay? In talking through that with some clients with home health care services is a challenge, I understand. And so many of them have concluded that they can't take advantage of an exclusion in this ETS, and therefore they are in a position to have to comply to it or comply with it. Okay, this number 6 exception, pay attention to because it's an important one, okay? If you are a healthcare setting, right, and none of these exceptions have applied to you yet, there is also an exception that applies to healthcare support services not performed in a healthcare setting. So remember, we started broad and we said this ETS applies to any healthcare settings in which healthcare services or healthcare support services are being performed. Well, then OSHA threw in an example and said, but if we are talking about only healthcare support services, this ETS also is not going to apply to them unless those healthcare support services are performed in an actual healthcare setting. It makes your head spin, I know, but the idea is this. If you are listening and you represent a larger healthcare organization, I know you have actual physical buildings in which some parts of your buildings are performing healthcare services directly, right? Patients are coming in and out to receive direct healthcare services. But maybe on a different floor, you've got your billing department, right? Or your legal department, or perhaps your HR department, okay? What this means is if you can separate out those healthcare support services from that healthcare setting, this ETS does not apply to those areas in which you're performing only those healthcare support services. Okay, and we'll take a couple of examples in just a minute and we can walk through that. Then the final example involves telehealth. Okay, this kind of is a no-brainer to me, quite frankly, and that's if we're doing telehealth, meaning, right, we're not directly interfacing with patients and it's performed outside of a setting where direct patient care occurs, then of course the ETS does not apply. Okay, so if you think of those examples and go back to where we started, which is the why, right? Remember I said we need to, as we're talking through this, we need to remember OSHA's why. And OSHA's why is because they think that healthcare workers are exposed to a grave danger if they are directly, right, exposed, have direct interaction with individuals who are likely to have COVID-19. So you can see how they've taken that why and then inserted it into many of these exceptions. Okay. All right, Sandy, next slide, please. So it does not apply in full, meaning the ETS also does not apply to any healthcare setting that's embedded within a non-healthcare setting, okay? So let's take an example. So if we have maybe a medical clinic within a manufacturing facility, the ETS will apply only to that healthcare clinic and not to the rest of the manufacturing facility. It also does not apply to emergency responders or others who enter a non-healthcare setting to provide healthcare services, right? So you can imagine an EMT being called into a grocery store to respond to an emergency, then of course the ETS is only going to apply to the provision of healthcare services by those emergency responders. And it doesn't mean that grocery store then all of a sudden is expected to be in compliance with this ETS because on an emergent basis, healthcare services were provided in their grocery store, okay? It doesn't apply to areas in which there is no reasonable expectation that a person with suspected or confirmed COVID-19 will be present. Again, that's getting back to the why of this ETS, okay? And then there are a couple of requirements that do not apply specifically to employees who are fully vaccinated. So for these, the organization, the employer might be required to be in compliance with the ETS, but then fully vaccinated employees don't have to follow the PPE, the physical distancing, and the physical barrier requirements. Okay, so let's take a couple of different examples to work through this idea of the depth and the breadth of the ETS. Okay, let's take a first example, and I think it's a fairly easy one, and that is a dentist's office. Okay, a dentist's office can likely take. Well, let's start at the beginning. They, on their face, would be subject to the ETS because they're providing healthcare services, right? Dentists are licensed practitioners who are providing healthcare services. So that means then the office would need to look at whether an exception applies to them. I think it's likely that they would be able to take advantage of that third exception, which is the non-hospital ambulatory care setting. And so long as that dentist's office is screening all non-employees, right? So any of their patients that are coming in and out for COVID-19 and are willing to and will exclude them if they have suspected or confirmed COVID-19, then that dentist's office can take advantage of that exception in the ETS and does not have to comply with any parts of it. Okay, let's take the next example, a school nurse. Okay, so this is a good example of a healthcare setting being embedded within a non-healthcare setting. Okay, so again, on its face, if a nurse is providing healthcare services in a school, on its face, the ETS would apply to the school, right? Because you have a licensed practitioner providing healthcare services. Granted, it's not in a setting in which the mission is to do that, or the mission is even to treat necessarily patients with COVID-19. But nonetheless, as written on its face, the ETS is broad enough to include them. So we'd want to look for an exception. If that school nurse is providing those healthcare services in a setting that is separated, right, out within the school, then the school would have to follow the ETS requirements just for that healthcare setting, but not for the rest of the school. Okay, so my practical advice likely to that school would be to say, can you contain those services that are being provided by that nurse or nurses from the rest of the services that are being provided by the school? Can you contain it so that you have a separate healthcare setting that is embedded within a non-healthcare setting? Okay, next example is a pharmacy, and we talked about that a little bit, right? So that exception only applies to the dispensing of prescriptions within a pharmacy by a pharmacist. It's unclear as to whether OSHA then intended the ETS to apply to other types of pharmacy services, right? Some of the most obvious ones that jump to mind for me are COVID testing and vaccination, right? So if a pharmacy or a pharmacist is providing those services, it appears as of now that OSHA intends the ETS to apply to those pharmacy employees. And if we apply the purpose of the ETS, meaning think about who has direct contact with individuals who might have COVID-19 or are reasonably expected to have COVID-19, it makes sense that that's what OSHA would say, right? If you have folks in a pharmacy who are doing COVID testing, probably OSHA intends the ETS to apply to them. Hospital lab radiology services. Okay, what about that example? Okay, we had some questions come in on that type of department, right? So in that example, that could only, an exception would really only apply if so that would be a hospital-based ambulatory care setting. So the exception would only apply if all of the employees were fully vaccinated and they were screening all non-employees who entered and excluded those who had suspected or confirmed COVID. If that's not the case, then that lab or radiology services likely has to comply with the requirements of the ETS. Okay, the PT, OT clinic, right? Whether the ETS applies to them is going to depend on whether that ambulatory care setting is hospital-based or not, okay? If it's not, then an exception would apply so long as they're doing the screening and exclusion. If they're hospital-based, then all of their employees are also going to have to be fully vaccinated, and they have to do the screening and the exclusions in order to take advantage of an exception. Home health, we talked about as well, right? There's that specific example that talks about home health. Unfortunately, that exclusion is only going to apply if those home health employees are fully vaccinated and you do the screening, and you don't perform the services, meaning you don't enter into the home if there is a suspected or confirmed case of COVID-19. What about a crisis services facility? Okay, that's going to be likely another example of an ambulatory care setting that is not in a hospital. Okay, assuming that those services are being provided by an individual who is a licensed or registered healthcare provider. Okay, and if that's the case, then the exclusion would only apply if that facility is doing the screening and also willing to exclude people who have suspected or confirmed COVID-19. Now, that is tricky for a facility doing crisis services, right? It may not be possible or make any sense to say that we are going to exclude people who have come there in a crisis to receive healthcare services because they maybe have a fever or something like that. In that case, that facility may look practically at whether or not it's feasible to physically have a different healthcare setting where they could treat patients or recipients who have suspected or confirmed COVID, right? So can we physically portion off some part of the facility so that those individuals who are receiving services are completely separate from everyone else, so that you only have to comply with the ETS in that separate portioned off healthcare setting? That may be something that is easily done, so that it's easier to do that than have this ETS apply to the entire facility. Or in some cases that may be almost impossible, and that facility may decide, well, it's easier just to have the entire facility comply with the ETS. Okay, finally, what about a building that houses some healthcare services, right? So I talked about that a little bit, right? So this ETS only applies to those healthcare settings, okay? So if you have parts of a building or parts of a facility that provide non-healthcare services, then the ETS will only apply to those parts that provide the healthcare services. Okay, so again, if we think about maybe a building within a larger healthcare organization setting, and within that building on the bottom floor, it's a doctor's office providing healthcare services to patients coming in and out. But on the third and fourth floor, we have the billing department and the human resources department, okay? So from a practical standpoint, probably what you're gonna have to do is comply with the ETS in the areas in which those patients are present, right? So if everyone is walking within in the same front door and riding on the same elevators, you should apply the requirements of the ETS to those settings. But then for all of those employees who are then working only on the third and fourth floors, the ETS likely does not apply to them, okay? It would apply to those employees working in the doctor's offices on the first and second floor. Okay, so I've tried to be as clear as I possibly could. Sandy, do we have some follow-up questions at all related to the overview of to whom and where the ETS applies?
Yep, I think a couple follow-ups or a couple of questions were in the queue before we started going through some of those examples. So I think those examples were perfect. We had a couple questions related to school nurse, those pieces.
Okay.
So we have a question here. Does this apply to an adult foster care home? So for example, right, we have to go back and make a determination of whether healthcare services or healthcare support services are being, provided in the setting, right? That's where we kind of should start.
Yeah.
And then determine if the answer is yes, if that particular setting is a non-hospital ambulatory care setting, for example, and if they have the ability to exclude people from care, if they're in a hospital but a well-defined ambulatory care setting, and they still have the ability to exclude those pieces. So that's kind of the analysis, right? Starting with, are healthcare services or healthcare support services happening in this facility? Okay.
Right.
Then what type of facility is it? Okay. Do we have the ability to exclude individuals who are COVID positive or symptomatic? Or are there areas that we can, for lack of a better term, right, cordon off where we're performing certain services? And so that's the analysis.
Right. Yeah, I sort of see it as a 3-step process for our listeners, right? The first is, are you performing healthcare services, right? Do you have people who are licensed or registered healthcare practitioners who are providing services to people within your setting, right? If yes, then we got to look for an exception, right? So are you can you fall into the non-hospital ambulatory care setting so that you can do the screening and exclusion? And if not, can we contain those services in some way so the ETS applies only to one part of your setting rather than the entire setting?
Yep, exactly.
I should add too, I mean, the way this ETS is written really requires a lot of individual analysis. And so it will not surprise me if many of our listeners come away with an understanding of what the ETS says or what analysis should be done, but they're still not exactly sure which parts of their organization the ETS applies to. And that's because this really is individualized and has to be looked at on a case-by-case basis. Okay, so I would encourage all of them to reach out to whoever their favorite legal helper, right, is, and talk through it and make decisions about their best strategy for compliance.
Yes, exactly agree. Yep. Okay, with that, why don't we go ahead and dive into the particulars? What does this ETS require? Now, as we go through this level of detail, you're going to see on the slides, we've identified, right, some things as new. And that generally means it means that you now have this specific requirement put upon you, right, by government mandate, right? It doesn't necessarily mean that in practicality, you all have been doing this for some time, right? So this might be a new requirement because it is new and it lives in an OSHA standard now, but it is certainly something that many of you may have been doing all along, okay? So there are particular portions of these 15 requirements that we're going to go through, and we'll particularly focus on those new pieces because some of those, at least for those who are listening here in Michigan, some of these things are going to look very, very familiar because they were requirements that lived in the October 2020 MyOSHA emergency standard for COVID. Okay, so the first requirement, a COVID-19 plan, not new for many of our listeners. Within the plan, we must designate a workplace COVID-19 safety coordinator, and we need to have the identity of that safety coordinator in our plan. So the plan needs to say who that person is. We need to conduct a workplace specific hazard assessment to identify potential workplace standards. That was a previous MyOSHA requirement. What is new related to the COVID COVID-19 plan, if you are a healthcare facility or you're covered by this ETS and you are invoking one of those exceptions based on fully vaccinated status, right? We talked about some of the portions of the ETS might not apply to you if you're in a well-defined area within a healthcare setting, providing healthcare support services where it's not reasonably likely that individuals will come in contact with patients who are suspected to have COVID or are COVID positive. If all of your staff are fully vaccinated, there are some portions of this ETS that would not apply to those settings. And so if you are invoking that exception, you have to have something in your COVID-19 plan that includes the policies or procedures that you're putting in place to determine an employee's vaccination status, right? You need to say there are some portions, right, of the safety plan that won't apply to some areas as long as staff are fully vaccinated. And here's how we verify that vaccination status. What is new related to the COVID-19 plan, an employer must seek input and involvement of non-managerial employees and their representatives in the hazard assessment and the development and implementation of the COVID-19 plan. So easily said on paper, in practice, we're all, right, 15 months into COVID-19. I highly doubt anyone on this call has waited until just now to put together a COVID-19 plan. And so what to do, right? We have an existing COVID-19 plan, and maybe we didn't seek input and involvement of non-managerial employees when we implemented that plan. Well, we do have a requirement under this ETS for that level of involvement. So that is something to flag as you make your individual assessments on what and how to comply with this ETS. Continuing on, more about the COVID-19 plan. Employers have an obligation to monitor ongoing effectiveness. That's not a new requirement. COVID-19, the plan must address hazards identified in the assessment and include specific policies to minimize risk transmission. A couple of new pieces here. The COVID-19 plan must also include procedures for effectively communicating and coordinating with other employers your COVID-19 plan. And this is specifically related to settings where you have employees of multiple employers, right? So I'm going to use an example of a hospital. Perhaps your food service staff are not hospital employees. Perhaps your environmental services staff are not hospital employees. Perhaps your anesthesia services staff are not hospital employees, but employees of another employer, okay? So if you are a setting where the ETS is required and you have your COVID-19 plan, you need to make sure you are communicating that plan to those other employers whose employees may be physically present in your facility, okay? You also need to have a procedure in place to notify the controlling employer when that employer's employees are exposed to a hazardous condition. So again, I'll just go back to my very generic example. If you have food service staff that are not hospital employees, as an example, if you're the hospital, you need to have a procedure in place where you reach out to the food service employer when one of those food service employees has been exposed to a hazardous condition. And you as the hospital then need to make sure you have a procedure in place that you are protecting those employees who enter locations that are not covered by the OSHA Act. So for example, if I have if I'm a hospital, right, and I have a durable medical equipment department as an example, right, that is generally part of the standard, but they are going and delivering equipment to somebody that would not be covered by this ETS as an example, right? So they're going into a location that does not provide healthcare services or healthcare support services, but they are doing their job there. You as the employer must, within your plan, identify how you are going to protect your employees in those situations, okay? The second requirement involves patient screening and management. So in settings where direct patient care is provided, the employer must limit and monitor points of entry into the setting and screen and triage all clients, patients, residents, delivery people, and so on when they are entering that setting, and then implement other strategies in accordance with CDC recommendations specifically related to COVID-19 infection prevention and control. So if you remember last week when OSHA rescinded their rule and MDHHS rescinded a number of their orders related to healthcare settings and patient screening, right? One of the big questions we got, okay, visitor screening, patient screening, people coming in, do we still have to do, right? Do we still have to be doing the questions, so on and so forth. So if you are a setting or a facility that this ETS applies to, don't throw away, right, those visitor screening protocols just yet. Because you are required under this ETS to maintain those consistent with CDC recommendations related to infection prevention and control. Okay. The third requirement under the ETS involves standard and transmission-based precautions. Employers must develop and implement policies and procedures that adhere to CDC guidance related to isolation precautions and standard and transmission-based precautions. Technically, that is a new requirement, right? But again, in practicality, many of you have been doing that all along. Number 4 requirement is related to PPE, and there's a couple different subsections under this requirement. And the first one is related to face masks. So if you are a setting that the ETS requires, and there's not a portion, right? We talked about all of the ways to exclude your setting generally or exclude portions of your setting generally, right? So we're talking about if you do not fall into any of those exclusions, this is the requirement for your staff as it relates to face masks. Employers must provide and ensure that employees wear a surgical, medical procedure, dental, or isolation mask that is FDA cleared, authorized by the FDA emergency use authorization, or offered or distributed as described in an FDA enforcement policy. So the big piece here is we're talking about something more than just cloth face masks, right? The ones that we've kind of all been wearing to the grocery store for a really long time. This is a step above that. So again, if you're a facility that the ETS applies to and you're an employee in a department, right? The department's not excluded, or you as an employer are not excluded for all of the reasons we previously talked about, this is the face mask requirement that applies to you. But luckily, there are some exceptions, and most of these exceptions are not new looking to us, things we're pretty used to, okay? So when an employee is alone in a room, they are not required to wear a face mask. When they are eating and drinking in the workplace, as long as they are 6 feet away from others or separated from others by a physical barrier. When the employee is wearing respiratory protection, of course, they're not required to also wear a face mask. When it's important to see a person's mouth or conditions don't permit a face mask that is constructed of clear plastic, face shields are required, right? So if you've got folks who are communicating through right, American Sign Language or something like that, or lip reading, and that's important. The face mask exception applies, but face shields would then be required. Of course, when an employee cannot wear a face mask due to a medical necessity or religious belief, we've recognized our obligations under the ADA and Title VII, right? From the very beginning, you need to go through that analysis, and where a face mask would present a hazard of serious death or injury, right? So if you're in a setting or performing a service where wearing a face mask would actually put an employee in danger, certainly they are exempted from wearing a face mask. Continuing under this number 4 personal protective equipment requirement, respirators and other PPE, there are certain situations where employers must provide respirators. Certainly when folks are exposed to people with suspected or confirmed COVID, and respirators and PPE requirements specifically related to employees who are involved in aerosol generating procedures that are being performed on persons with suspected or confirmed COVID. Should have said at the outset, this presentation is going to be one where it's going to be helpful probably to print out these slides. So you've got the technical requirements of each of the 15 large categories, but we are not going to dive into each of those requirements as we go through. Okay. Still on the PPE requirement, certain requirements where PPE, again, respirators and other PPE during aerosol generating procedures performed on individuals with suspected or confirmed COVID. Now, use of respirators when not required. So we've gone through those couple requirements. These are the situations where respirators are required, okay? So if you are an employer or an individual, and the employer says, well, we don't have those situations, but we still want to require our employees to wear respirators. Sure, fine. Or if you're an employee who says, I'm not required to wear a respirator, but I because I'm not doing any of those things you just talked about, Sandy, but I really want to. So we're talking about, I'm using air quotes here, but voluntary use. You're not required by this standard to do it, but either you as the employee is doing it on your own, or the employer is saying, employees, we are requiring respirators in these type of situations. The ETS absolutely allows for that, but requires the employer to follow some very specific requirements. So within the ETS, there's something called a new mini respiratory protection program. And there are certain notices that an employer must provide the employee, even if I'm the employee saying, I want to voluntarily use a respirator, the employer is then obligated to provide them certain notices. If I am the employer and we are making this a requirement, and we're making an organizational decision to have it be a requirement rather than this standard requires us to have our employees wear a respirator. There are certain requirements that we must now follow, including training, certain type of fit testing and user seal checking, and certainly subject to monitoring reused requirements and discontinuing use certain of those requirements. Okay. And if you are involved in standard and transmission based care, right? For example, so if you're a direct care individual, this ETS now requires certain types of PPE when those types of precautions are instituted. Number 5, aerosol generating procedures on persons with suspected or confirmed COVID. Some of these requirements, quite frankly, seem a little bit repetitive. We covered some of this in the prior PPE requirement. But some additional safeguards that an employer must put in place. So again, in practicality, a number of those on the call have likely been instituting these safeguards all along. The employers should limit the employees present during those procedures, and to the extent that you have an airborne infection isolation room, that's where the procedure should be being performed. And after the procedure, you have requirements for specific cleaning and disinfection requirements consistent with CDC guidelines. Number 6, physical distancing, something we're pretty familiar with, not necessarily a new requirement. So to the extent feasible, we must be ensuring employees are separated by 6 feet when indoors, unless the employer can demonstrate that's not feasible. So a little bit on this requirement, it's kind of flipping that an employer must be able to demonstrate an infeasibility of physical distancing. In practicality, that's probably not all that different. It reminds me, right, of my OSHA kind of remote work standard, right, where there was some obligation on the employer to stop, pause, think about it, make a feasibility determination, and if it's not feasible, at least be able to articulate why, and if it's not feasible, ensuring that employees stay as far apart as possible. So not necessarily a new standard. Physical barriers. Remember at the very beginning, we highlighted there are a couple of provisions that take effect on take effect a little bit later. Most provisions take effect, or you must be compliant rather, by July 6th. A couple have a little bit later, longer of a runway. This physical barriers requirement is one of those. So by July 21st, for workstations outside of direct care areas where employees cannot be separated by 6 feet, employers must install cleanable or disposable solid barriers except where that is infeasible. Okay, so again, technically a new requirement, but probably something you've all been doing all along, particularly our Michigan employers. Number 8, cleaning and disinfection related to patient care areas and resident rooms. The ETS is directing us to implement the CDC guidelines here, COVID-19 infection prevention and control recommendations and guidelines for environmental infection control. Again, as I think about the listeners on the call, I'm sure that you all have been following those pretty closely all along. Okay. Continuing on cleaning and disinfection for all other areas. So we're talking about not direct patient care. Employers must continue to clean high touch surfaces at least once a day and institute an additional kind of cleaning protocol where you become aware a person who is COVID-19 positive has been in that area within the last 24 hours. So that was a old requirement in the OSHA rules, so not necessarily new. It's more just as if it was continuing here in the ETS. Same with this next requirement where an employer must provide alcohol-based hand rub or access to hand washing facilities. Ventilation, number 9, again, a section here that compliance is required by July 21st. And most of these pieces are not new, new in terms of being written exactly this way in a standard, but not something that most of our employers haven't been doing, right? We're required to use our HVAC in accordance with manufacturer's instructions and design. We're required to use our HVAC in a way that maximizes the number of air changes, making sure that we are using appropriate MERV rated 13 air filters or higher, making sure we're maintaining and replacing air filters, we're cleaning intake ports, and where we're doing aerosol generating procedures, the employer must maintain and operate those HVAC areas in accordance with design and construction. Number 10, health screening and medical management. Let's talk about this. So if you are in, again, we're talking about if you do not fall into any exclusion, right? Your facility generally is not excluded, department is not generally excluded, or your employee is not generally excluded. You as the employer must screen each employee before each workday and each shift. And if COVID testing is part of that screening, you of course need to provide that test to each employee at no cost. So not huge changes there. You do have certain notifications that are now required, and some of these are going to look very familiar to you. Employer must require employees to notify you when they are COVID-19 positive, when they've been told by a licensed healthcare provider that they're suspected to have COVID-19, when they're experiencing recent loss of taste or smell with no other explanation, and when they're experiencing both a fever and new unexplained cough associated with shortness of breath. So those last 2 requirements are technically new in terms of the way that they are worded, right? But here in Michigan, we are very familiar with the COVID-19 Employment Rights Act, which required our employees to stay away from work under certain conditions, right? When they have tested positive, when they are experiencing certain symptoms, when they're close contacts. And so this ETS is a little bit of a variation of that requirement, but a protocol that most on the call are likely very familiar with. Continuing with the health screening, the employer, right, we're back into having some notification requirements. So within 24 hours, we need to notify any employee who is not wearing a respirator and any other PPE and has been in contact with a COVID-19 positive individual, not a COVID-19 positive patient, okay? This is excluding those that are COVID-19 positive patients who are coming to us for care. So this is other individuals in the workplace, okay? We have to notify all other employees who are not wearing a respirator and any other required PPE, and have worked in a well-defined portion of the workplace where the person was present. So if I'm not working on a floor that is treating COVID-19 patients, but a different patient as an example, and we've since found out that that patient has tested positive for COVID, the employer now has some notification requirements to reach out to me to the extent I wasn't wearing a respirator and so on, and I came in contact with that person. Okay, and then notifying other employees, and other employers whose employees were not wearing a respirator and other PPE and had been in close contact. So again, we talked about, I used the example of food service, don't use it again, right? So to the extent that we have this situation in our facility and we have had employees of other employers in contact or in those spaces, we need to be notifying those other employers. We, of course, are required to maintain confidentiality when we are doing those notifications. That's not a new requirement for us. And again, as I mentioned, notification is not triggered by the presence of a patient with confirmed COVID-19 in the workplace. That we're talking about other people. And what's particularly helpful in some ways where the ETS is generally not helpful, there are sample notification documents on the OSHA website, and we will link those to a new OSHA ETS compliance tab within our resource center yet this week, so be on the lookout for that. Number 10, continuing. So medical removal of the workplace. There are certain situations that are going to require us as the employer to keep employees out of the workplace. So again, many of these are not familiar to, or excuse me, are not new to us, are very familiar to us. So if we have an employee who's tested positive for COVID, yes, we need to keep that individual out of the workplace, not a new requirement. If we have an employee who is suspected to be positive for COVID or who is displaying some symptoms, we need to keep that individual removed until they meet return to work criteria, right? So following the CDC guidelines, that time frame. Or we need to keep the employee removed and provide them an avenue to take a PCR test. And if that PCR test is negative, they can return. So those requirements there mirror the requirements in Public Act 238 or Michigan's COVID-19 Employment Rights Act. So that's helpful. So you are also required to keep certain close contacts out of the workplace, but only under certain circumstances. So if the employee was not wearing a respirator and any other required PPE, and they were in close contact with the COVID positive person in the workplace, or they were not fully vaccinated, or they have not recovered from COVID-19 in the past 3 months. So I just want to pause a little bit here. If we remember for our Michigan listeners, Michigan's COVID-19 Employment Rights Act has a kind of general close contact exclusion for healthcare employees, okay? So this OSHA ETS is a little, doesn't have that broad exclusion, but does allow us to not have to close contact quarantine those close contact healthcare employees if any of these certain exclusions apply. So I wanted to flag that for all of our listeners, that we no longer have a broad healthcare employee close contact exclusion, but there are still situations where our employees do not need to be subject to close contact quarantine, okay? And of course, then if an employee is subject to close contact quarantine, they need to remain out of the workplace for 14 days, or the OSHA ETS says if you test that individual at day 5 and that test is negative, that individual can return at day 7. You might remember the CDC updated their return protocol for close contacts to that type of timing several months ago. Okay, continuing with health screening and medical management. A big piece here is in those situations where we must remove an individual from the workplace, all of the situations we just talked about, we are now required to ensure that those individuals have benefits, okay? So employers with less, this should say, I apologize, employers with 10 or less employees, you're not required to provide benefits. But employers with more than 10 employees, you must pay the employee the same regular pay the employee would have received if the employee had not been absent from work, up to a $1,400 a week cap until that employee meets return to work criteria. However, if you are an employer, you have more than 10, but you have less than 500, for the first 2 weeks, you still have to pay up to the $1,400 cap, but beginning at that third week, then you have to pay 2/3 of the regular pay that the employee would have received, up to only a $200 a day weekly cap. The good news here is that an employer can meet those obligations if the employee is receiving any kind of publicly or employer-funded compensation, such as through a paid sick leave program or an administrative leave program. So as we read this, although it's not entirely clear, but our reading is an employer can meet that medical removal protection benefit requirement by having employees use their own PTO or paid sick leave program. Okay. Let's move on to number 11. I'm trying to be conscientious of time here. Vaccinations. Employers certainly are not required to require vaccinations, but employers must support COVID-19 vaccination for employees by providing reasonable time and paid leave, such as paid sick leave, to employees for vaccinations and any side effects experienced following vaccinations. So that is a new requirement. Number 12, training. By July 21st, so this is another requirement that has a little bit of a delayed compliance date. Employers must provide employees information on COVID-19, including how it's transmitted, importance of hand hygiene, how to reduce the spread by covering your nose and mouth, signs and symptoms of the disease, risk factors, severe illness, when to seek medical attention, so on and so forth. So you see that first bullet, I don't have a new note next to it. So generally, I would say many of our listeners, the previous training that was required under the OSHA rule, generally the training that you were giving fit those pieces, right? You were covering those pieces. However, now under the ETS, there are some additional requirements that you now must fold into that training, okay? Again, some of these, no doubt you were doing, but just wanting to make sure we flag them to the extent that you need to go back and address some of these new areas. Employer-specific policies and procedures on how you will screen patients and manage patients. Identifying the tasks and situation in the workplace that could result in COVID-19 infection, talking about the workplace-specific policies and procedures that you are instituting to prevent the spread that are applicable to the employee's duties, the employer-specific multi-employer workplace agreements related to infection control policies and procedures, the use of common areas and the use of shared equipment that affect employees at the workplace, employer-specific policies and procedures for PPE, workplace-specific policies for cleaning and disinfection, employer-specific policies and procedures on health screening and medical management, right? So you're telling your employees, you're providing training to them on what the screening procedures will look like, the situations that you will require them to remain outside of the work area, and so on and so forth. Available sick leave policies and COVID-19 benefits that employees may be entitled to, You need to identify in your training, you need to identify who your safety coordinator is as specified in your COVID-19 plan. You need to inform employees on how they can obtain copies of the emergency temporary standard and any of your employer specific policies and procedures that you have implemented because of that standard. And then of course, as always, you need to be ready to provide additional training as needed. So when there has been a change to a risk related to contracting COVID-19 in the workplace, a change to your policy, or we've identified that your employee doesn't have an understanding of what our policy is and they need retraining. You must have a knowledgeable person overseeing or conducting that training. So you can still do training remotely, but whoever is putting that together needs to be a knowledgeable person. And the training must provide an opportunity for interactive Q&A with that knowledgeable person. Okay, so a bulking up of those training requirements for sure. So 13 is a new anti-retaliation requirement. Employers must inform each employee. So you have a proactive obligation to tell employees that they have a right to the protections required by the ETS and that employers are prohibited from discharging or discriminating against employees for exercising rights protected by the ETS. Of course, any of the requirements that you implement because of the ETS, you're obligated to do those at no cost to the employee. And you have some additional record keeping requirements. So for employers with 10 employees or less, these record keeping requirements do not apply to you, but everybody else. As it relates to your COVID-19 plan, you're obligated to retain all versions of that plan that you've implemented to comply with the ETS. And you must now keep a COVID-19 log, excuse me. So within 24 hours of learning of any positive case of your employees, regardless of whether it was a work-related or not. So we're not talking about a recording or reporting requirement as it relates to OSHA forms, right? We're not talking about the OSHA 300 or anything like that. We're talking about a new document that you keep internally, where you're recording the name of that employee's occupation, the last date they were in the workplace, one form of contact information, so phone number, email, address, one form is fine, where they have been in your facility, right? What are their work locations, and the date of positive test, date of symptom onset. And the thought here from OSHA is that this document is going to help employers with the contact tracing that they need to do to make sure that others who have been close contacts, it's easier to identify those individuals. So to the extent that you're a listener and you've already been doing something like this, this isn't necessarily a new onus, right? A new onerous requirement, but now you're required to do that and have those on hand. The big news here is really making that information available. So you now have an obligation by the end of the business day after someone makes a request for information, you must make certain information available. So certainly if the Department of Labor Assistant Secretary contacts you, you have an obligation to provide them any records that you're required to keep under this standard. If an employee or their personal representative or their authorized representative reaches out to you, you have an obligation to provide them your COVID-19 plan. And as it relates to the COVID-19 log, certainly an individual or anyone that individual has authorized to access this information is entitled to receive a copy of the individual log entry for that particular person, right? So if Sandy Andre is somebody that you're putting in the log and I make a request for the information contained in that log as it relates to Sandy Andre, I am entitled to that information. And then broadly, individuals, any employee's personal representative or their authorized representative is entitled to kind of anonymized version of this log that does not include employee names, right? It includes only locations, last date in the workplace, date of positive test, diagnosis, or symptom onset, right? So any employee can ask for that information, and we have an obligation to provide that to them. And then number 16, reporting. Not a new requirement here. These are the same reporting requirements you have under existing OSHA and MyOSHA standards. If you have an employee who has a work-related COVID-19 fatality, you're required to make a notification to OSHA or MyOSHA within 8 hours. If you have an individual who has a work-related COVID-19 inpatient hospitalization admission, you're required to notify OSHA or MyOSHA within 24 hours. That is not a new requirement. Whew. Okay.
Okay. Wow. Thank you, Sandy. Oh my goodness. Okay. I know probably a number of folks either have to or would love to get on with their day. But let me just, if you don't mind, let's just take a couple of questions because I see some that many folks have asked. The first one is this. As I look at this ETS, Sandy, I see the mask requirement applying to employees only. Do you agree with that? I'm getting asked, what about patients? What about visitors who come in? Is this requiring me to wear masks? And what if they're vaccinated, et cetera?
Right. Yes, I agree with you, Sarah. This face mask requirement, as I read it, this is related to employees only. Certainly, we still have the patient screening requirements, but that does not have a face mask component. I agree.
Okay, got it. So those healthcare settings should be making their own decisions and also, of course, be relying on any state or local requirements for that, right? In Michigan,
yes.
Those have largely gone away, but in other states they have not. Okay, so you all are going to be making your own decisions about whether to require your patients and visitors and others coming in and out to wear masks. Perfect. What about screening? This concept of that healthcare screening comes up in several places. That, as I'm looking at this ETS, Sandy, it defines screening as just asking questions to determine whether somebody has COVID or has symptoms of COVID. It doesn't appear to require an actual temperature check. Do you agree with that?
Yes, I agree. Yep.
Excellent. Well, then we are on a roll. Okay. One other question I see 2 or 3 times is this for that requirement to provide pay to employees who are off work for COVID-related reasons. Okay. Does that payment likely include a shift differential, meaning if employees work certain shifts, they get increased pay? What are your thoughts on that? And if you want me to give you my thoughts first, I'm happy to do that.
Yeah, I think my initial thought is we have to think if the employee was working today,
right,
would they be entitled to? So if they are a second or third shift person and they were working, but we now have to exclude them because they fall into this criteria, I need to be making sure as the employer that that employee is receiving at least that benefit up to the caps that are listed there. That's my initial thought.
I think that's right. The ETS, and let me be clear, the ETS is not specific on this, right? As is the case with many of our questions. But it does say that the employer must continue to provide the benefits to which the employee would have received had the employee not been absent for work. So if the employee would have worked a shift that would have paid that differential, I think it likely the ETS requires that employer to pay the differential to the employee.
Yep.
Okay. Other than that, I see a lot of questions that, quite frankly, are more specific to individual situations that are probably too hard for us to answer in a large setting like this. So let's close here, Sandy. And I just want to thank you for your depth of knowledge on this, and thank all of our listeners for coming to the webinar today. And we will talk to you all soon. Have a great day.
Absolutely. Bye-bye, everybody.
Bye-bye.